Hi, welcome. What I'd like to talk about with this afternoon would be some questions about knee replacement surgery. When would I be a candidate for knee replacement surgery? What's involved? What does an implant look like? Those kind of questions. To start with, we've come up with some frequently asked questions. We put these on our web page. If you can click on this will answer a lot of questions kind of for what happens before surgery, in the hospital, and after during recovery. But in general, I just want to talk to you a little bit about my philosophy about knee replacements. Knee replacement and knee arthritis is something that can fluctuate up and down. Knees can be painful for a month. The pain can go away and disappear for a couple months. It can fluctuate up and down. But when you get to the point where you're having knee pain on a daily basis, that's keeping you up at night, that's preventing you from standing for long periods of time or going out to walk your dog, or participate in sports activities, or you look at your weekend and you say, no, I don't want to go to Costco this weekend because I can't handle that, 45 minutes of walking, that's going to ruin my weekend, I'm going to be done. That's when patients need to start thinking about it's time for knee replacement surgery. Everybody knows somebody who's gone through the procedure. There's good outcomes, there's bad outcomes, but you really want to maximize all the kind of conservative treatments that I think we've talked about in some of the other videos, including injections, braces, anti-inflammatories, pain medications. When those conservative treatment modalities are not working anymore and you're having pain all the time, that's really when it's time to come in and talk to an orthopedic surgeon about what's involved in the knee replacement. People ask me what type of knee do I put in, and in general I put a couple different types of knee replacements in, and I put the right knee in for the right patient. There are different types of arthritis, different patterns, different deformities, and as orthopedic surgeons there's many different types of implants that we can use, and I have focused it on choosing the right implant for the right patient. One of the main questions with a knee replacement is, do you make a cut, you can cut here and you take the whole knee out? That's not really what happens. It's more of a resurfacing procedure. So this is an example here of a knee replacement in a plastic bone knee. Main question always is, what do you do to the kneecap? Well, you can see here from the side here that this is the normal bone on the outside here. The kneecap gets flipped over and the bad bone and bad cartilage get removed, and then a plastic button gets cemented into place. What happens to the femur and the tibia? Similarly, we make a series of cuts to therefore then implant metal on both sides. Sometimes it's titanium, sometimes it's metal. And then the middle space right here gets filled with plastic. That's polyethylene. That's the part of a knee replacement or a hip replacement that wears out over time. It's just basically a fancy Teflon. And then once the components are in place, it relies on all the patient's normal ligaments, tendons, anatomy to keep the knee replacement stable and allow you to get you through your normal range of motion. A frequent question that gets asked is, can the arthritis come back after a hip or knee replacement? It can't. All the arthritis is gone. We remove all the cartilage during the surgery. Loss of cartilage is arthritis. So the arthritis is not coming back. The implants in generally get cemented into place, so 10 minutes after the cement is dry, they are stable. They are ready for you to stand on immediately the day of surgery, walk that day, walk the next day. Knee replacements are stable right from the get-go. A lot of patients will ask, how do we get into the knee? Typically we go beside the kneecap, go through a little bit of the tendon, and what this allows us to get full access to the knee. Part of what can be invasive in a knee replacement is taking measurements to put the components in place. Part of a technique that I use is a patient-specific or pre-planned procedure where an MRI is done. If we're able to do that and insurance approves that, that allows us to be less invasive in terms of dissection, to make all the appropriate cuts, to put the knee in exactly where we pre-planned it, the pre-selected size. That allows us to be less invasive, less bleeding, so you can get up right away and the knee feels more like your knee. A very common comment or something I'll talk about with patients is a knee replacement should get rid of about 95–96% of your pain. There's still going to be some pain in your knee that comes and goes from time to time from ligaments, tendons, bursa, soft tissue structures that any knee or hip or elbow can hurt from time to time. Your knee will be light years better than it was before, but it's still a knee with a knee replacement. And I think that's important for patients to understand. I frequently tell patients it's not your knee like it was when you were 20 years old. It's a knee with a knee replacement. Can you kneel? Can you walk? Can you water ski? You can do all those things. When you kneel, it will feel a little bit weird because there's plastic under there. As time goes by, you generally get used to it, but the knee replacement is built to do that. I do allow my patients to go back to, as I said, walking, golfing, hiking, horseback riding. There's no restrictions except running. If you need to run across the street to catch a bus, yes, you can do that, but it's not built for repetitive running. That will wear down the plastic or the polyethylene at an accelerated rate and potentially make your knee wear out sooner than you or I would like. That's what I'll cover for now. There's more information in the frequently asked questions. Thank you for taking the time to watch this video. If you have any further questions, please contact us at 602-631-3161.